on acute appendicitis, a common abdominal emergency especially in adolescents. Our patient is Lisa, a high school student who came in with worsening abdominal pain. In this video, we'll guide you through her symptoms, the anatomy involved, the pathophysiology happening inside her body, our diagnostic reasoning, and her final management. We'll proceed to our clinical case.
Lisa is generally healthy, though she eats irregularly because of school. Her pain started around the belly button, which is right here. After a few hours, it moved to her lower quadrant, which is right here, just beside the belly button. She's also been experiencing nausea, vomiting, and mild fever. Though these symptoms altogether shows a process of inflammatory on her lower abdomen. Thank you.
Lisa's symptoms, let's break them down and understand what they indicate. First is the periumbilical pain on the onset, then it migrates to the right lower quadrant. And then there will be nausea, vomiting, and a mild fever. This sequence is classic for appendicitis. The migration of pain is a major flu with a combination of GL symptoms and a mild fever points out to inflammation.
So the main organ involves here, the appendix. The appendix is a small light finger pouch that attaches the cecum of the large intestine. Think of an appendix as tiny as tube with a narrow opening. When that opening becomes blocked, whether it's facilitated or swollen with tissues, it cannot be flow out. Fluid accumulates and bacteria multiplies, pressure increases, and that causes inflammation. And that's what happened to Lisa's that acute appendix.
Inside the body, the patterns follow a predictable way. Firstly, we have obstruction, bacterial growth, increased intraluminal pressure, and lastly, inflammation. This explains why Lisa firstly felt vague, poorly localized around the belly button, because in early stimulations of inflammations, it localized the visceral nerve to stimulate, which explains why the pain can localize very well.
As inflammation got worsened, it reaches the parietal peritoneum on the right lower side here. That's why her pain became sharper and migrated here also.
I already received her laboratory result form and the image of ultrasound. This laboratory result form, it showed an elevated white blood cell count, meaning her body was fighting an infection. And this ultrasound image, it confirmed an inflamed, non-compressible appendix. Combined with her symptoms, this makes the diagnosis clear: acute appendicitis.
In appendicitis, the definitive treatment is surgical removal of the appendix, usually done through laparoscopic appendectomy, which uses small incisions and allow fast recovery. Before the surgery, she received IV fluids hydration, antibiotics to control infection, and pain medications for comfort. These steps help stabilize the patient before undergoing to the operation.
Appendicitis can't always be prevented, but maintaining regular meals and eating dairy fibers.
Dietary fiber in our diets. Dietary fiber refers to the indigestible fibrous materials in our diets. A good example of this is cellulose that is present in fruits and vegetables. These fibrous materials are important because it provides bulk to the intestinal contents and helps peristalsis.
May help reduce the risk of blockages.